The big driver for this whole health initiative from Jubilee is a lot of the inequities that we've seen just in data. So unfortunately, our neighbors have a lower life expectancy. We have higher disease rates and higher ER visits. So really the big picture goal is to try to change some of those statistics. So how do we help folks live longer, quality lives? How do we reduce ER numbers? And how do we reduce diseases in the neighborhood? Really big picture is driving the change in the numbers that we've seen through the programs and resources offered within the building, within the campus, and really within the neighborhood.
When we look at providing healthcare, one of the big challenges, how do you put all those pieces together? Because it tends to be a very siloed industry. So a huge appeal here at Jubilee is to be able to tie in healthcare, physical health, dental health, mental health, and then all the social drivers of health too that wrap around. So it really is the kind of model that you're looking for when you're trying to establish a clinic for a community.
There is a drastic need for mental health services, just as there's a drastic need for people to have good food and shelter, because if you have an emotional issue, it's no different from having a physical issue. It's the same, we all have problems. Having Parkland downstairs is called wraparound services, where people can get a lot of things done in a small area. It's really great.
Yeah, so it's an area of very high medical necessity. So there's very poor access to healthcare just in general in South Dallas, but specifically around the Jubilee Park Center. The whole purpose of this place really is for equity, because for a lot of people, getting access to healthcare, it's very, very difficult. And having lack of access, it terribly affects your quality of life. Actually, a lot of the patients I see, they live literally across the street. So they just walk over for their visits. It's much more convenient for them compared to having to go, let's say, like 5, sometimes even 10 miles to get to their general appointments. And that's a cost to them that sometimes they can't afford. At Jubilee, they try to do a holistic approach, specifically not just addressing the medical needs, but also the social needs for patients here as well. So having access to the Jubilee Center just down the street here, which has been very helpful to a lot of patients in this community, that's a very big resource.
One of the things that impresses me so much is how the community comes out and participates. They don't feel like they're being dictated to, but they feel like they're part of driving the change and owning the change in the community. And I think that's really the magic of Jubilee.
There was a need, we're fulfilling it, it's a success, and I think that's the thing that keeps everybody with skin in the game.
I think it's just proof that if you invest, good things will happen. It's just awesome to see, everybody thriving. If you invest, they will thrive.